You have to fight for it. There has got to be more accountability for the payers to just all willy-nilly throw things out and deny and say we're not going to cover it. We have contracts in place for a reason. You have said you're going to cover this service. You have said you're going to give us money for this. It takes 6 months to pay us. There has to be some new laws put in place. There has to be something that says this is illegal for you to just not cover children, to just not want to cover their pay. Someone has to protect them in this, and the payers are just allowed to just sit on it and just for no reason not give us the payment or deny it.
Cathy, thanks for joining us.
Of course. Thank you for having me.
Yeah. Tell us about your background, how you got to where you are today, and then I want to hear more about Codman.
Sure. So I went into healthcare, was my first job, like real job out of college. I started at the front desk, so insurance verification, billing, coding. The more I started to work in healthcare and the more I started to work on the back end pieces of it, it's just grown from there. So taking on projects, so project managing, building, workflows and in like bridging gaps and things like that. So it became a love for me. And it's not just like the idea of a job or a career, but it's like, this is something that's really fun and invigorating and engaging, and was able to just continue to grow from there. Codman came in. So I joke about this all the time that I didn't pick Codman. Codman really did pick me. It was not something that I was like, I have to go work at Codman. But it was something, fortunately, that has worked out. And it's been such a great experience. You know, we're given these opportunities and experiences for a purpose. And the purpose is that Codman, I'm able to work with so much of the community and see some of these gaps and disparities in healthcare that we often overlook or may not be aware of. So having that opportunity just kind of thrown at me and pushed into a role that I may not have normally picked has been amazing, both for me personally and professionally. So it's been a fabulous a journey.
And what do you think has kept you so committed? I mean, it's been over 20 years at this point in
healthcare.
In healthcare, yeah. I'm just curious, what has kept you so committed?
It's not, so I think it goes back to, it's not just this profession. It's not just this something that we're here to do, but it's very personal. So being in healthcare has been very personal. I've seen from, family members that have been dealing with chronic illnesses. I've seen where the system is broken and where we need people to advocate for these gaps in healthcare, and people to advocate for those of us that don't understand. So, if I go to the mechanic and the mechanic is telling me all these words and things about my car, I'm like, I have no idea what you're saying. And because you don't know what questions to ask. You don't know when to push and when to advocate for yourself. So bridging that gap and adding in that additional education and teaching people that you can ask questions, you can push back, you can advocate for yourself. That is what has kept me in healthcare, to really make sure that people feel confident and comfortable in taking up, advocating for themselves.
Codman is unique in that it's a federally qualified health center. And, I think for the group or for the listeners that may not know, tell us more about what that means and what's unique about and we call it an FQHC setup.
Yeah, so an FQHC serves underprivileged communities, and that's exactly what we do at Codman. We run primarily on grants. So a shoestring budget and a prayer, basically, is what keeps our doors open. But with those grants, the idea behind an FQHC is fabulous. We're here to support a community that may be overlooked, that may be underserved, and usually are. So I say maybe, but it really is underserved and it really is overlooked. And there really isn't a lot of people in the corner pushing and advocating for these proactive treatments and proactive care, but it's rather this, reactive care and oopsie checks and things like that. So an FQHC is unique in the fact that we are there for a purpose. We're there for a reason. But because we rely on grants, because we rely so heavily on government assistance, we are at the mercy of of the government. We are at the mercy of those grants. We are at the mercy of the red tape and the, all of the hoops that we have to jump through to support the communities. The idea sounds fabulous. We're here, we can do these things, but in execution and in real life, it's a fighting for your life constantly. It's a fighting for our patients instead of just doing what was promised. In the beginning. Yeah.
It's almost providing healthcare, but like on hard mode, right?
Yes.
Because, you get, and I mean, I think what we see in a lot of the work we've done with FQHC is even how you reimburse or even how you report or even how you build, there's just 2 or 3 layers of added nuance on how you have to do it to make sure you get the proper subsidies to keep your doors open.
Yeah, I think 2 or 3 layers is generous. It's like a brick wall sometimes that we have to fight. And it's like, why is this so? If you're going to support us, then support us in a way that makes sense for us to support our patients and not continuing to have to beat our head against the wall and fight and yell and scream to get the money that was promised to us to do the job that we said we would do.
That's right. I want to take it back to your experience starting your career at the front desk, and now today you run the entire ref cycle department, which I think is awesome, and that's the life that we live every single day, right? I think maybe talk to us about what you learned by actually doing the job for so many years that now helps you run the full department.
That's what makes me unique in the sense that I've been at the front. So so front to all the way up to the top of where I am now. I understand and I see firsthand what's going on at the front desk, which means I already know where their gaps are. I already know where we need to make changes in our workflows, changes in how our leadership is connecting with the people that are boots on the ground. These are the people that are doing the work. Whereas us at the top are like, oh, that sounds great, but let's make these changes. But there's a ripple effect that goes down that the leadership doesn't necessarily always understand because you're not in it. And unless you're in it, you don't really understand all of the effects that go on. So having started from the front and working all the way to the top, I can see and I have that unique perspective to at the very start. Of course, we're there for our patients, but at the very start, my goal and my view on all of it is what can we do to make our staff happy? Where can we make sure that they are empowered, they're comfortable, and they're confident in their jobs? Because when they are, it only makes it better for the rest of their team, but always makes it better for our patients. So having that understanding and that empathy for the people that are boots on the ground doing the hard work, patient-facing work gives it a unique edge.
And is there anything unique you've done in terms of setting up your team that maybe others may be able to learn from given this unique experience you have?
Yeah, I think it's a great question. So my philosophy is I will do whatever so the conversations I have with my team and anyone, but especially my team is, you tell me what you need in your job to be successful. You tell me what you need to feel more confident and empowered, and I will do the things. If you need more training, if you need more resources, if you want me to guide you and lead you, I will be your advocate. I will be your person pushing you through. I've been fortunate in my career in the last 20 years that I've had really strong leaders that are here like, I'll lead you and I'll teach you all the things, but you do the work. So I've been able to take that and give it back to my staff and say, I will lead you and I will give you all of the things that you need to be successful in whatever your version of success is. But let's do it together. And let's you take that initiative and I will go with it.
That's awesome. Moving more to the clinical side of Codman, you serve a community where I think you said a majority, close to 90% of your patients, English isn't the first language, right? What are some of the unique challenges that come up, and how have you guys addressed that?
Our unique challenges are pretty much, making sure that they understand what's going on in a way that makes sense to them and their culture and their language. So a lot of our staff are from the community, which is beneficial because they already know some of the challenges. They already understand some of the gaps in information. They already understand the disparities, and they most likely have experienced it themselves. So really breaking it down, I think in order to help people, you have to understand where they're coming from first. It can't just be like, here's all the information, but then it's not in a way that really kind of resonates. So there's this gap there. And that is really pretty much what healthcare is there's this huge gap. It's like, we want to give you this, we want to help you, but not make it so that they understand how we're doing it, what we're doing. So the biggest challenge is breaking it down in layman's terms, very, very simplistically, and saying, this is what we can do for you. This is how we can help you. And in a way that resonates and lands for them. So language, it's linguistic, it's cultural, it's, all of the things that make sense.
And you speak about folks in the community. Can you talk maybe really, really quickly about hiring and recruiting and some of the things that you've done there to make sure you can get the best talent, and then, to your point, retain that talent as well? Because I think just hearing you talk about it, having folks from the community likely makes the quality of care just that much higher.
Yeah. We have really good staff that are able to connect. So if you walk into the enrollment center at Codman, it's not walking into an enrollment center in a community health center. It's, hey, honey, how are you? And like hugging them and shaking their hands. And it becomes very homey. It becomes and it goes back to greeting them in their language, greeting them in a way like shaking their hand or bowing to them in a way that would make them feel like, okay, this isn't just this very like sterilized place like health center, but this is a place that's in my community that understands me and that truly is here to help me. So when we are interviewing and recruiting, anybody can learn the job. I can teach you how to do anything for the most part, but I need to know that you are going to look at our patients when they walk in the door, and they are the VIP when they come in this building. They need to feel special. And that isn't always something that you can teach. So that is what we're looking for, is can you really make our patients feel like they're welcome and really connect with them on that level? I can teach you all the other stuff. We can teach you the back end workflows. I need to know that you can be a human first.
Wow. I love that. And, I had the privilege of visiting a few months back, and I think we all felt that coming out of that visit. And it was just amazing to see the community that was cared for as well. And at the end of the day, it is such an integral part of the community. And so I think that's such a unique take in sort of how you think about getting the right type of people. And then as it relates to translators and sort of being able to connect in the sort of the language that folks come into, how have you guys set that up? Because I think that's pretty unique in at least what I've heard of.
So we do work very directly with a translating service that we're able to get someone pretty quickly. But also our staff speaks a variety of languages too. So we're able to ask them, what language do you need today? So if someone's not on site that speaks that language, which is ideal, of course, because you're talking face to face with a human, you can see their facial expressions, you can feel the energy that they bring to the table. But if we don't have someone available, we do have a translating service that's amazing, that also does a great job of being that bridge for us when we need it. Awesome.
And then can you maybe just talk about, you guys get grants from the government and how does that relate with the reimbursement that you get? And because your setup is so unique that there is this government reliance, maybe talk about your perspective on underpayments, contract disputes. This is probably where you live a lot of your life in, right? What makes that government aspect unique as it relates to these core parts of revenue cycle?
Yeah. That is where I live a lot of my life, is the fighting and the begging and the pleading to say, because we're an FQHC, we are a safety net clinic. And the idea of a safety net is we're there to catch all of the things, all of the people, and make sure that no one falls through the cracks. But and that's where our contracts come in to say, we've already set you up. We're going to pay you this. We're going to do these things. You can cover this. But what we've found in reality and execution is that safety net has holes cut all through it. So people are falling through the cracks. We are not getting the money that we were promised. We have to stop providing services and start shutting doors in certain areas because that safety net doesn't exist. Mm-hmm. And when it does, there's like big holes and we can't patch it because we are at the mercy of someone else. So, when we, see these denials, when we see these missing, the denials is huge. And that in itself, so here's a little side tangent, that in itself should be illegal. If you've said that we can have this money to care for our patients, children included, which is a whole different tangent, like we can do a TED talk on that, that in itself should be illegal. To just be like, we said we would pay you, we said we would like take care of your community, just kidding. Or you have to wait 6 months. Like, well, in 6 months, we are shutting doors and we're letting people go. So now we're not able to offer those services. Now we have to send them elsewhere in a way that is not like, how does that benefit the patient? What is the point of having this safety net and relying on these grants if they're invisible and we're chasing them? So it's chasing something that is almost never coming to fruition in some cases. And we have to, again, go back to living on that shoestring budget and a prayer that something will come through, because what they promised us doesn't exist.
And have there been cases, or maybe if you want to highlight a few, where you weren't able to provide the care that you wanted to or you needed to because you got some level of underpayment, or you didn't get everything reimbursed or denied? Like maybe give us that patient or clinical perspective as well.
We see it a lot in behavioral health, unfortunately. So mental health is one of those big gaps. And it's something, this is a topic that a lot of people are talking about right now. It's a hot topic, but the idea that we have to wait for certain prior auths and referrals to come through before we can provide their service. But mental health doesn't work that way. If someone's having an emergency or needs attention, it's not like, hold that thought for just a second.
Right.
Like, take a breath. We got to go get this referral. And if we don't do those things, we're out of luck. Like, we'll still see our patient because we have to. It's the right thing to do. Someone is in need of help. But then we're kind of back in that vicious cycle of, now we don't have the money to do it. And now we have to kind of send this patient somewhere else, which that in itself is its own risks, to send them out. Like, we know that you're struggling, but we can't do anything for you here. We have to send you somewhere else. So mental health is a big piece of that. We see that more than anything else.
Yeah. And in that case, when you transfer that patient somewhere else, oftentimes you guys are the last line of defense, right? So it's almost like, where do you even go?
That's right? That hole in the safety net. Like, our safety net's not here. There's a big crack in it that someone cut. Purposely.
So I think that's why the work you guys do is so important. It's just unfortunate that sometimes the reimbursement gets in the way of providing really good care. And then, what do you think, say if I turned it on its head and said, if you didn't have to spend time chasing all these payments, right? And I'm sure you have a large team that does it, or sometimes even the clinicians are thinking about it, right?
Yeah, all the time.
Which you want them to be providing care, right?
Yeah.
Like, where do you think you guys would focus more time on, or spend more time on, or put your energy towards? Because there's just so much energy that goes towards just recovering payments that you should be getting paid
so
on,
much of it. Yeah, a lot of our providers, because we are a small community health center, a lot of our providers are very in the know. They're very hands-on. They know the struggle. They're fighting the struggle too. So if we were able to get back that time and energy, we could actually start doing community outreach. We could actually start spending our time and our money and energy on connecting with the community and investing in the community, which is what we should be doing. We should be building the community up. And right now it's like we're barely keeping our head above water. We can't help them and save them if we're barely hanging on.
Given that, this is tough, right? This is not easy for you guys to play in this space, but you guys are doing such an important mission. What keeps you guys going every single day and pushing forward, even when you see like such an obvious case of a patient that should have been covered and isn't, and now you have to find the dollars from somewhere to go help that patient in this behavioral health case? What keeps you guys motivated and going?
The patients really do. Honestly, we're there to care for our patients. We're there to help our community. So it's keeping at forefront the patient, the needs, the mission, and making sure that we are aligned with that no matter what. Yes, the job can be draining. Yes, the job is hard. Yes, it can suck. But as soon as every day we're able to take a step back and look at this and be like, okay, we made a decision to be here. We made a decision to really work hard, but it really is staying true to why we're doing it in the first place, which is advocating for our patients, advocating for our community, and really giving a voice to those that are kind of just swept off to the side or covered over or fall to the background because it's been so hard for them to get service and so hard to be seen and heard that they're just like, forget it, man. Like maybe this isn't important. Maybe my elbow will heal on its own and I don't need to see an orthopedic. Like I'm good. It's not worth the fights. Yeah. And we don't want those people to leave feeling like that. Like no one's listening to you for a basic human need, right? Like this is something that we need to have as healthcare and caring and allowing for someone to hear us. And that is what keeps us going. Even on days we're like, okay, I'm not coming back in these doors anymore. It's like, okay, but somebody has to fight for them. And fortunately, I have a loud voice and so does my team.
Yeah. Just switching gears a little bit, let's talk about the role of technology in some of the work you do and some of the more innovative approaches that you may have taken recently. Maybe the first question there is, talk to us about your technology strategy, right? So how have you thought about deploying AI or language models or just basic workflow automation across Codman?
How have we thought about it? So because we spent, obviously it would be such... it would give us so much of our time back because everything is so manual for us right now. Our providers, everything is manual. And this kind of goes into connecting with our community too. When our providers are spending so much time writing a note and like typing and looking at their computer, but they're like, I'm here with you. Yeah. I'm listening. But that to me is equating to someone texting while you're trying to have a conversation with them. Like I'll wait until you're done before I finish our conversation. So there's that, having that AI or the scribe or anything that's going to help us better connect with our patients, I think is huge. And we've had those conversations so many times, like how can we remove so much of that manual piece so that our providers, one, can offer patient care, but two, have a life of their own and not spend so much time doing all of the admin stuff, which is what they're doing and fighting. So any initiatives that we're working on is to better benefit the clinician-patient aspect of it and build that stronger relationship. What we're looking at now is scribes is a big piece of that, but also automating a lot of our billing and coding is what the RCM piece of it, so that it's not so much of our time and we can start focusing on other areas that need attention.
That makes sense. And then in terms of on the patient care side, are there any innovative approaches or projects you're taking for some of these immigrant communities that you work so closely with? Whether it's technology or non-technology related.
So one of our biggest projects right now that we're working on is integrative team-based care, which I absolutely love. I'm a huge fan of any type of integrative care and integrative approach because we really can treat the whole person, not just say, oh, your elbow's here. Awesome. We also noticed that you had an infection in your ear, but that's not what we're here for. So like really treating the patient as a whole person. So our integrative team-based care is something that we're really working on. I'm super excited about. Our providers are super excited about, but it also gives us a unique perspective to say the patient was here for their elbow, but we also noticed these other things. Maybe they haven't had a woman's health exam. Maybe they didn't have their, all of this other stuff, and we're able to just pass them along and get them all of the care while they're here and we have them, instead of letting them go back and hope that they come back to see us for all the other care that makes a difference.
And how does someone or a group that's looking to set this up, because it, like from first principles, that makes a lot of sense on make sure you treat everything and not just the elbow or just the shoulder, but how does one go about setting that up if they're interested in doing so?
So we're at the very infancy stages of doing that, and a lot of our planning, we just had our first meeting on it a couple weeks ago. A lot of our planning is, one, what do we do when our payers come back and say, hey, we're not covering all of these visits in one day?
That's right.
Because we know that's exactly where that's going. But if we move that to the side, because we already know that's going to be a struggle, and we look at logistically and systematically, what can we do? Building up those pieces and making sure that everything's flowing in our EHR to say this, we can watch the patient's journey through the health center from one clinician to another, one specialty to another, is something that's in the early stages of building and planning. But I'm hoping that whatever EHR system we use, whatever scribe system we use, is able to just integrate all of those pieces and just flow through it naturally.
Got it. It is so unfortunate that, in trying to provide great care, what we're talking about is, are you going to get reimbursed for it or not?
Yeah.
But that's the unfortunate reality. No, I think that makes a lot of sense. And are you guys unique in offering this? Are you guys some of the first that, especially at your guys' size and sort of type of center that you are you guys, it sounds pretty unique in terms of the approach.
Yeah, it's unique for an FQHC,
Correct.
for this community health center, because of the payment scale that we have to worry about. But we're almost at the point like, well, we're not getting paid anyway. When we do the right things, when we do it in the right order, if we're going to go down, we're going to go down big. And at least we're going to be able to care for our patients appropriately and not based on, well, your elbow is taken care of, but come back for that ear maybe next week and we'll see what happens. So I love that the fact that our clinicians and our leadership is looking at it. And yes, of course, we're worried about revenue. Of course, that matters. But we're like, we want to care for our patients first. And we see this gap. And especially if because they're not English speaking and they're new and they don't understand our healthcare system, they come in and they feel overwhelmed and bombarded by all of these things that we say, oh, you need an auth, and oh, you're not covering, oh, like all of these things are like, I just wanted to be seen, but never mind. Like, this is too much. It's not worth it. So, I love that our clinicians and our leadership is just kind of putting that to the side for right now and focusing on what can we do to make this more streamlined and more at home and for our patients, and putting them first and foremost.
That's incredible. I mean, just looking at a bill, you don't know what half the things on that bill mean,
and
right?
I work in it, and I'm like, what is this nonsense?
Right. No, I think that's such an awesome initiative. And then, what advice would you give for other revenue cycle teams, whether in FQHCs or not, or private practice or inpatient, that are trying to balance great patient care with financial sustainability? Because I think a lot of what we're talking about, right? I mean, even the comment you just made is you guys will go down with a fight, right? You will make sure that patients are taken care of. And I think that's so important. I think oftentimes what we hear is the owners and clinicians run into this dilemma of you got to be able to run a business.
Of course.
But then you also want to give best-in-class patient care. And sometimes those two things can be at odds. So I'm curious your perspective there.
Oftentimes they are at odds. It's like they butt up against each other, unfortunately. Financial sustainability is patient care. At the end of the day, of course, as a business, we need to make money. But at the beginning of the day, we are here for the patients. So anyone that's struggling with, dealing with our payments and our revenue and just in general, trying to get through all of these changes that we have coming in healthcare in general, is staying focused on our patient, on the community that we're serving, but also on advocacy and staying so grounded into the mission and why we're doing it. So that's the key, is why are you doing this? Because we can surface level say that we're here for a reason. I'm here because whatever reason. But if you're not so foundationally grounded into why you're doing it, you're going to get knocked off course. You're going to lose focus. And that's the biggest thing I think that will make a difference, is you have to be so concrete in why are you doing this? Not surface level, I'm doing it because of my job. I'm doing it for the patients. Those things matter, but we need to be rooted into why it's here and why it's happening. And that will keep us, even when the winds are blowing and people, the doors are shutting and things are falling around us. But I'm so grounded into this spot. It keeps the mission going. It keeps us focused on the patients. It keeps us focused on each other and growing it as a community and just staying locked in.
And how do you preserve that culture? Is that a culture that was actually at Codman before you joined? You've built that culture? Is that just the type of people that you guys work with? That's they're just really grounded in the mission.
A lot of our providers are. A lot of our clinicians have been there for decades.
Wow. And
are so committed to the work that they do in the community that they serve. And it really is, when you hear I've been here for 32 years, oh my goodness, that's crazy. But they are in it. They know why they're here, and their why is so ingrained that nothing's changing them. Of all of the things that have changed in healthcare, they're unmovable, they're unshakable, and they're not moving from that. I like to think that in my group and my team that I have, that I've started to build that community, started to build that rock for them, that foundation to say, why are we here? not because you need a job. Money is important. Of course, we have bills to pay, but why this one? Why are we here for our patients? And really continue to foster that along the way. And it's like a little ray of sunshine.
Yeah.
Anywhere it's going, people are going to feel that warmth. If you're here and you mean it and you're in that energy, no matter where you go, other people on the team, even if they're having a crappy day, they feel that warmth like, okay, I can get back in it. Okay, I've had my rejuvenation and I'm fine.
Yeah.
So, and I think as long as we stay in that and we keep that focus, we can continue to spread the sunshine.
No, that's awesome, and it can be tough, right? Especially when you're dealing with these really, say specifically on the rev cycle side, these really tough payer regulations and rules, and on that point, what changes do you want to see from the payer side, right? Or from some of these just massive hurdles that you have to clear in order to get reimbursed? I'm curious. I'm sure you've thought a lot about this over the time you've been in healthcare. Like, what does that ideal outcome look like from the payer side?
Oh, the payer side. There has got to be more accountability for the payers to just all willy-nilly throw things out and deny and say we're not going to cover it. We have contracts in place for a reason. You have said you're going to cover this service. You have said you're going to give us money for this. And to just allow them to just kind of do what they want, take 6 months to pay us, there has to be some accountability. There has to be some new laws put in place. There has to be something that says this is illegal for you to just not cover children, to just not want to cover their pay. And I bring, like, for any human, really, but I bring it back to the children because they're so innocent in this. Like they're so, and someone has to protect them in this, and the payers are just allowed to just like sit on it and just for no reason not give us the payment or deny it, and just in large volumes. And that kind of goes to, how is this okay? How is this okay that you're allowed to just decide on? And a lot of it's automatic, and it's not even a human looking at it and be like, oh, we'll let this one go, or we're not going to cover this, but it's just going through a system. No one sees it until you fight for it, and you have to fight for it or it's not getting covered. Yeah.
I mean, there have been reports of payers, and not to name any in specific, but where in bulk, in the thousands or tens of thousands,
large volumes.
Yeah,
yes.
You'll just see auto denials and auto rejections. Now, the good news is you can reprocess them and get them paid, and so you can still make sure you're financially whole. But a lot of the margin is in just following up, right? And if you're just not able to follow up because you're not able to hire, you're not able to just get to every single claim, or you're not able to just see full coverage, that's the margin is in that friction, right?
Yes.
Of these just claims getting stuck, and we see these 100 different buckets that you have to go after.
Yeah, we have to spend so much time and energy on it. And for the smaller, and we don't get to touch 100% of our own claims either for those denials. So that's money that's just like going out the door. Those are denials that a patient's now see. Now they're responsible, and they come to us and they're like, we came to you for help. Yeah. You said we were going to be covered. You said this medication or this service. And we're like, like, what do we do? Like, we're at the mercy of that, but we also don't have the manpower to spend the time and energy that payers require for those appeals in a lot of cases.
That's right. One final question I have on my end is, what are you looking forward to, right? So what is, you call it, the next couple of years, whether it's Codman or it's called just the industry more broadly? What are the, like, kind of that you talk about that ray of sunshine that you want to look forward to? What do you look forward to? Like, why do you, and we spoke about why you stay in this, and I think that's important, but what do you look forward to?
I look forward to there being a more sustainable human approach to healthcare. What we're doing now is not sustainable. It's not a human touch. It's not patient-centered. It's all of the other things other than that. I think it would be great if we started really to focus on our patients, to say, in mental health, like the whole patient, like we said, you're not just here to say there's something wrong with your elbow and hope to see you next week for all the other things that are wrong with you, but where can we start to heal you and focus on proactive care in healthcare instead of reacting? Because at that point, usually it might be too far gone, or we've waited so long that now all of these other things are going on. And it's like, what what sense was that? Why are we doing this anyway if we're just going to like wait until things are falling apart? It's like if your house, you see a crack and you're like, I'll come back to that later. Well, by the time you come back to it, your roof is falling down, your doors are sticking. Like, why do you want to do that to a human body? Like, we don't function that way. So what I would love to see is we stop focusing so much on, we don't want to pay you from these payers, that accountability, but also really focusing on the patient's needs.
Awesome. Well, thanks for the time. We appreciate it.
Of course. Thank you so much for having me.